Now, cancer treatment comes with huge challenges, but dental problems are one of the less well-known side effects of chemo and radiotherapy.
And now there's a call for free dental treatment for cancer patients. There's a petition calling for a change, which has reached more than 100,000 people in a week. Now, Michelle Solak-Edwards is the woman behind it and joins us now. Good morning.
Good morning.
Now, there is a reason you are the person to talk to about this, because you are recovering from triple-negative breast cancer. I think you were diagnosed in 2016.
Yes.
So that involved you going under, what, 9 months of...
9 months of chemo.
Right.
Not very pleasant.
Not very pleasant. You're looking fantastic.
Thank you very much. It certainly wasn't then, though.
So tell us what that involved. And, you expect to hear that it ravages the body because you're effectively putting poison into the body to kill the cancer.
Yes.
But the side effects aren't always as well known.
No, they're not. For me, I've got osteoarthritis now in quite a few joints. I had minor dental issues, but not too many. There have been long-term side effects for me, and there are for a lot of cancer patients as well. I've got away relatively lightly compared to some people.
You mentioned dental problems there, and this is what you're campaigning for now.
Yes.
What is the problem specifically in relation to people getting this treatment and the possible effects in terms of their teeth?
The problems with getting treatment are that it's not free at the minute, and if you have to give up work or you're on benefits that are not means tested, you have to pay for dental treatment. And people don't realise that chemotherapy, radiotherapy and all the other sorts of life-saving treatments you need for cancer do have an effect on your mouth. If you start treatment and you have any problems with your mouth, you can get infections. And of course, if you're undergoing chemotherapy and radiotherapy, you have no immune system.
So you mentioned you personally had some problems with that, but not as bad as others.
That's correct, yeah.
What happened?
For me, I just had a crumbling tooth. I've got increased sensitivity. Mine happened after chemotherapy, and that's quite common actually. The side effects can go on for many years. I know one lady, she's 47 years old. She had a checkup before chemotherapy started, and after chemotherapy, she had to have every single one of her teeth, apart from 4 teeth, removed, and she's now got 2 dentures.
And was she told that was a direct result of the chemotherapy?
Yeah.
And yet she wasn't entitled to any help with the payment?
She had to pay £3,000.
What has been, people hearing what you're accounting there, and that story particularly, they're thinking, well, obviously something should be different. What has been the rationale behind it not being part of NHS, so not being paid for?
Now that I don't know, but what I do know is I thought when I brought this campaign forward that dentists were going to burn effigies of me and say, no, don't do this to us. But actually the dental world are on board with this, and it's amazing that they have identified that there is an issue. There's also an issue that people can't get in with NHS dentists unless they've already got one.
That's due to the wider problem of just getting access to dentists in the first place.
Absolutely, and the cost is a big factor. Yeah. But coming back to your question, why has nothing been done about this before? I don't know. Pregnant ladies get free dental care for a year. Cancer patients don't get anything.
What do you think the petition's going to do? I mean, because it's great having support for this. Obviously, you've campaigned for this. This is important to you, but it's having the petition. And I know you've got Kate Green, I think, your MP, who has been supporting you with this as well. Where does it go from here? Because I can tell you, sitting on this sofa, we've spoken about NHS funding, and it is in crisis.
Well, I'm not going to stop. I'm not going to stop because the way that the NHS funds dental treatments is there are 7 regions throughout England, and they're each given a budget, and the directors of each region can decide how much they spend on dental care. So it could be 1%, it could be 50%. So really we're looking at, it's not every single cancer patient that will need dental treatment. It really isn't. 1 in 2 of us will be diagnosed with cancer, but out of that, not everybody will need dental treatment. So yes, it is extra resources needed from the NHS, but it may not be as much as we think. There are going to be extreme cases, and then there are going to be cases like me where it's actually not that bad.
The Department of Health and Social Care has said that it will ensure that by next year, every person diagnosed with cancer will have access to personalised care, including needs assessment. So not means testing, but needs assessment. A care plan, health and well-being information and support. Is that a good step forward?
That's absolutely a step forward if that does include dental treatment, because sometimes the mouth and dentistry isn't thought of, that the body
This is in relation to high quality dental care.
Well, that would be amazing. I mean, that's a step forward, but I'd like to go a little bit more. I would like cancer patients to have priority dental treatment if they need it, because it can stop you having your life-saving cancer treatments. If your mouth isn't in tip-top condition, they won't start the cancer treatments. So it is imperative.
Michelle, good to talk to you this morning. Good to see you looking so well. So thank you very much.
Thank you very much.
It is 15:15.